I'd like to tell you about a special group of women who are helping move our understanding of pregnancy, birth outcomes, and child development forward. This is a rather large group of women, in fact, 3,300. Together with their children, they make up the All Our Babies cohort. These women generously provide detailed information on themselves by completing surveys during their pregnancy. The first baby was born in 2008, and our last baby will be born next month, July 2011. Women then complete this part of the study by answering a questionnaire when their infant is 4 months of age. 1,800 of these women have also braved needles twice during their pregnancy to provide us with blood samples. They've allowed us to collect leftover cord blood after delivery, and in this moment, many are in the midst of completing surveys to tell us more information as their children turn 1 year of age. These 1,800 women are helping us understand the relative contribution of genetics from the blood samples and the relative contribution of the environment from their lifestyle information towards predicting the risk for preterm birth. Our research won't stop shortly after birth, though. Our plan is to continue to gather information from all 3,300 mothers and children up until the children start school and potentially beyond. We're inspired to work with this cohort over several years because we believe it will help us identify markers of early risk to child development so that efforts can be undertaken to reduce the impact of these threats early on. For instance, imagine for a moment that a mother suffers from depression when her son is a baby, but she's embarrassed to seek help. At 3 years of age, her son is well behind others in speech and language development. The therapist working with this boy is finding that her caseload is becoming increasingly heavy and advocates for bringing in more speech therapists. She also asks local researchers to help her understand why this may be occurring. Analysis of the All Our Babies cohort reveals that the risk of speech and language delay is highly predicted by poor maternal mental health in the prenatal and early postpartum period. Hiring more speech-language therapists will enable more treatment, but the All Our Babies cohort data has brought more information to light. An important part of the solution may be to identify mothers at risk during pregnancy and shortly after birth, and take action to prevent speech and language delays. The opportunity is to reduce the chance of delay, address root causes, and support families when we can. While there will always be an important role for treatment, when we can intervene early or reduce the severity of something or even prevent it, good things can happen for children and families. These are just some examples of how I foresee partnering with those providing care and making decisions about resources and use of facilities in Alberta to answer questions relevant to their roles and in the effort to improve outcomes for Alberta's children and families. I think there are unrealized opportunities to use cohort data to answer questions of importance to researchers, policymakers, and decision makers, and to translate this information rapidly into changes in programming and practice. Cohort data can be helpful for clinical decision-making and for trainees who can focus on the development of much more complex research questions when they don't have to collect the primary data, such as outcomes associated with use of assisted reproductive technology or outcomes associated with preterm birth. If the data has already been collected, they can more rapidly turn this information around. We can also use this kind of data to build content and analysis expertise in the important area of child and maternal health. So the All Our Babies cohort and others like it, including the Alberta Pregnancy Outcomes and Nutrition Study, both funded by AIHS, can have long-term utility for the province and help us answer important questions and train the next generation of researchers. Thank you.